Growing up, I had a lot of injuries, interacted with a lot of physical therapy and physical therapists, and they taught me a lot about myself, and just being around them, learning about what they do, how they do it, it got me interested in the field, and I decided then, I think I was about 11, that PT is what I wanted to do.
I wanted to do something that incorporated science, incorporated patient care, working within the healthcare system. For whatever reason, I didn't have a passion for medicine. I didn't want to be a physician. I was fortunate enough to play collegiate football, so I had the athletic exercise background. So just the blend of science with exercise, it just seemed like it was a great fit.
I did a year of medicine and realized that's not what I wanted. I wanted much more patient time. I didn't want to diagnose a pathology and not be able to treat my patient for more than 20 minutes. So I went back to my public health background and I worked for a year and then decided physical therapy was what I wanted to do.
I chose PT because of my experience growing up very rurally on a reservation. I had an injury myself at a very young age, and most of my family had a lot of injuries, and there's really no access to it out there. We had to drive at least 100 miles for just to see a PT that would be there 1 to 2 times a week, maybe. And so it became kind of an interesting thing to me to pursue that and possibly, you know, expand opportunities for people in rural areas.
You know, as a physical therapist, you have the opportunity to make a difference in the world. You know, and if you look at, you know, healthcare and our role, you know, physical therapists are needed, and your impact will always be required.
It's something you live. I remember after my GATE class, every one of my classmates said the same thing. When we went to the malls, when we were waiting for a bus, we were driving, we just watched people walk by and say, oh, they need a lift, or they need to change shoes. It's something that you live every day.
There's so many different avenues you can explore. So not only can you go after, you can be a practicing licensed physical therapist, but you can go into academia, you can go into research, being a practicing clinician, also the mentorship piece. So there's just so many different areas that you can go into, so you can be involved with the patients and make a difference in their lives, but you can also meet your goals as a career-minded professional.
I think it would be important for students who are interested in physical therapy to go ahead and shadow in all the practice settings that we have. Do an acute care hospital, do a skilled nursing facility, do home health, inpatient rehab, do as much as you can to see the diversity that's out there and see if any one of those suits your interest. And if so, then go ahead and pursue it. Because it's important to understand and be sure that you're ready to commit, not only financially, but commit your time for 3 years, time and effort for 3 years on top of attaining an undergraduate degree.
If I were to give advice to another student, I would have them really think about why they're applying physical therapy school, why they're gonna join this profession. It's a really hard profession. School's not a joke. It's very rewarding, but I think if they realize why they're doing it, it's gonna make school that much easier and their life in physical therapy that much better.
Enjoying your profession, enjoying what you do is important, but also knowing that you're gonna actually be able to do it when you get out. And that's one of the great things about PT. It's a growing profession, and it's needed, and I like it. So I think for me, it's the perfect match.